practical step-by-step analysis of the disruption and difficulties that are currently faced. We judge which of those issues can best be resolved either through an extension of the grace period or by revisiting the operation of aspects of the protocol. The Joint Committee exists for that purpose, and I look forward, even though his Select Committee no longer exists in its current form, to having the opportunity to update him and others in the House about the progress that we make.
I said to Gloucestershire with Lawrence Robertson. Lawrence Robertson.
Thank you, Mr. Speaker. At such meetings, will my right honourable friend raise the issue of food producers in Great Britain having their standards approved by BRC under the Global Standards for Food Safety, and when they're approved at the place of manufacture, that there is no need to check each and every case of food products when they reach Northern Ireland, thus ending the totally unnecessary disruption when they reach those ports and the delays to fresh food.
Well, my honourable friend is absolutely right. There is no need at all for that level of physical inspection, none at all. And I will continue to work with those on the ground in order to reinforce that point.
Let's head up to Durham with Mary Kelly-Foy. Mary Kelly-Foy.
Thank you, Mr. Speaker. Does the Chancellor of the Duchy of Lancaster agree that last Friday's disarray demonstrates the real danger to stability of triggering Article 16 in Northern Ireland and the profound uncertainty it would create for businesses? And does he agree that the focus should instead be on making the protocol work and finding long-term solutions that will avoid disruption caused when the grace period comes to an end and minimise the disruption on trade between Great Britain and Northern Ireland?
Well, I absolutely agree with the Honourable Lady that the focus should be on, in the hours and days ahead, on making life better for the people of Northern Ireland by making sure that goods can flow freely and that their lives are not affected in the way that they have been. But as I mentioned earlier, it is appropriate to recognise that there may be circumstances in which Article 16 may need to be invoked or deployed. It exists for a purpose, but it was the case that the Commission, in the way in which it invoked it, did so completely outside the rulebook.
Let's head to the West Midlands with Suzanne Webb. Suzanne Webb.
Thank you, Mr. Speaker. Can my right honourable friend take this opportunity to confirm that the UK government will never tolerate any attempt by the European Commission or any other foreign authority to deny the people of Northern Ireland access to the COVID vaccines that this government has been so successful in securing?
Well, I entirely agree with my honourable friend. I think it gives me an opportunity to say thank you to everyone who's been involved in the vaccine rollout across the United Kingdom. Our National Health Service is a precious aspect of citizenship of the United Kingdom. It's National Health Service personnel who've been responsible for making sure that our vaccination programme has so far gone so well. They deserve the credit, and it's government's job to make sure that people in Northern Ireland can continue to receive the vaccines that they deserve.
Let's head to Northern Ireland again with Gavin Robinson. Gavin Robinson.
Thank you very much, Mr. Speaker, and can I extend my appreciation to the Chancellor of the Duchy of Lancaster, the Secretary of State for Northern Ireland, and indeed the Prime Minister, for their continued engagement in seeking resolutions to what appear to be intractable problems. He has helpfully suggested that the extension of the grace period for pets and the work on seeds and plants cannot just be solved through continual extensions of those grace periods, but a practical and workable solution which balances the zero risk associated with those sectors. Can I also thank the Chancellor for the comments that he has made about the threats and intimidation to the Honourable Member for North Down and indeed my colleagues in Strangford and Assembly colleagues in East Belfast and in North Belfast. What we need to see and what we need to demonstrate clearly and quickly is that constitutional politics works, and we need to get those solutions through constitutional politics.
Well, I couldn't agree more with my honourable friend, and he knows that he and his party colleagues have been assiduous in bringing to my attention, to the attention of the Secretary of State, each of the individual concerns that they have, and that they have done so in a speedy, effective and low-key way, which has reflected the desire of him and his party colleagues to resolve these problems. And I think he is absolutely right. We need to see that resolution in order to make sure that people's electoral representatives are heard and are effective.
Andrew Rosenthal.
Mr. Speaker, as someone who cares passionately about our United Kingdom and Northern Ireland's permanent place within it, will the Chancellor of the Duchy of Lancaster agree with me that the European Union's willingness to trigger Article 16 as soon as it was in their interests clearly undermines their claims that during the negotiations that a border in Northern Ireland was not something they can tolerate? And will he also agree with me that the government should now seek to replace the Northern Ireland Protocol with the EU, because they've clearly shown that it wasn't simply about the interests of Northern Ireland, but more about their own economic and political control. They've been shown up for what they really are, and it's time we put the interests of the United Kingdom and the people of Northern Ireland first.
Mr. Gove.
Well, I entirely agree with my honourable friend that we have to put the interests of all of the citizens of the United Kingdom, including the citizens of Northern Ireland, absolutely first. And I also agree with him that it was regrettable that just 28 days after the protocol came into effect, that it was the EU that decided to trigger Article 16 in the way that it did. I want to work with those in the EU who are genuinely committed to the interests of the people of Northern Ireland, like Vice President Maroš Šefčovič, because I think the most important thing for me to do now is to do everything I can to help ensure that the lives of people in Northern Ireland are improved. But he makes a fair point about the need to take a step back and to make sure that we look at all of these issues in the round.
Let's head up to Scotland with Margaret Farrier. Margaret Farrier.
Thank you, Mr. Speaker. Recently, it has been reported that the MOD will have to complete customs forms before moving equipment or personnel to Northern Ireland. Can the Chancellor of the Duchy of Lancaster assure us this is not going to impede UK military support to the PSNI under Operation Helvetic?
Absolutely. The very idea that the UK armed forces should be prevented from in any way operating in any part of the United Kingdom is utterly unacceptable.
Mark Francois.
Thank you, Mr. Speaker. The whole point of the Northern Ireland Protocol was to avoid the creation of a hard border on the island of Ireland. And yet late last week, the European Commission, in an act of stunning hypocrisy, attempted to do exactly that, affecting medicines and critical vaccines. It's blown up in their face, but if they ever doubled down and tried it again, then the President of the Commission would unquestionably have to resign. In the meantime, in the Joint Committee, will the Chancellor work with Mr. Šefčovič to try and really rip back these problems, particularly those goods at risk? Can we narrow them down to a very, very small number instead of, at the moment, virtually everything being treated as if it were at risk with all the attendant bureaucracy that goes with it?
Minister.
Well, my right honourable friend is absolutely right. And again, as I mentioned briefly in my response to the honourable lady, the whole point about Article 16 is that it's there to safeguard the interests of the people of Northern Ireland. It's not there to ensure that you can somehow control the export of vaccines from Belgium and the Netherlands. It's not appropriate. His broader point is absolutely right. We do need to make sure that we work rapidly within the Joint Committee to address these issues, and indeed, once we've done so, take that step back and look at how we can safeguard Northern Ireland's position in the round.
Let's head to Enfield with Farrell Clark. Farrell Clark.
Thank you, Mr. Speaker. Does the Chancellor of the Duchy of the Lancaster agree that the protocol is the best way to ensure stability in Northern Ireland and that it must work for businesses and communities? And does he therefore agree further joint steps are needed with European Union to reduce the potential mountain of red tape on the food products when the grace period ends in April?
Yes, the honourable lady is absolutely right. We must make that progress.
Let's head to Lincoln with Carl McCartney. Carl McCartney.
Thank you, Speaker. How can my right honourable friend reassure my constituents in Lincoln and all Northern Ireland citizens that Article 16 is not triggered as likely by the European Commission in the future? It took less than a month for it to be triggered, with little realisation of the potential ramifications by anonymous foolish actors in the European Commission. But thankfully, ministerial colleagues, including the Prime Minister, ensured that the European Commission made a swift U-turn on this occasion. Does the government intend to revisit the arrangements, as after recent events, this would be a justified request?
Well, I think my honourable friend makes a very important point. I think you could never predict the future with accuracy, but I think given the universal condemnation with which the Commission's actions were met, I think that they know that they need to step. They had to step away. I think it's remarkable that when you have the Archbishop of Canterbury, Carl Bildt, the former Finnish Prime Minister Alexander Stubb, and all of the parties in Northern Ireland and the Taoiseach and the Irish Foreign Minister all critical of the decision that you've made, then this isn't some sort of gaggle of Eurosceptics, rehearsing traditional lines. It's just recognition that the Commission mucked up.
23 withdrawn, so we go to Jerome Mayhew in Norfolk. Jerome Mayhew.
Thank you, Mr. Speaker. The Joint Committee is empowered to determine the practical arrangements relating to the UK's implementation of the protocol. Given this morning's need to suspend animal-based food checks at the Port of Lawn because of paramilitary threats, it's clear that these decisions have real physical consequences. So given this, what conversations has my right honourable friend been able to have with his counterparts in the Joint Committee on the practical steps, not only to de-escalate the situation, but also to ensure that food supplies are maintained and eased in the future?
Well, my honourable friend is absolutely right, and I had the opportunity to talk to Vice President Šefčovič over the course of the weekend on Friday night and on Saturday afternoon as well. As I mentioned earlier, he's very conscious of these questions. Whatever criticisms might be directed at some, he should be exempt from criticism because he is absolutely committed to working to resolve these issues in a practical way.
Final question from Northern Ireland with Carla Lockhart. Carla Lockhart.
Thank you, Mr. Speaker, and can I join with others in the House today in condemning the attacks on the parliamentary office of the Honourable Member for North Down and indeed my own party colleagues. The Chancellor will know that unionism is looking closely at how this government addresses our very valid and principled opposition to this protocol. These are not teething problems, and the Chair of the Select Committee should desist from such dismissive language. Does the Minister agree with me that continuing to ignore one section of our community would be reckless when the foundation for political progress in Northern Ireland, which I want to see protected, is predicated on cross-community consent? And would he also agree that as the mechanics of East-West sit broken by this protocol, it is inconceivable that North-South mechanics will continue to operate with the consent of the wider unionist community?
Well, my honourable friend makes a very important point. In reflecting on the gains that have been made since the Belfast Agreement was secured, we need to recognise that that agreement underpinned the principle of consent. It made certain that Northern Ireland's place in the United Kingdom would be respected by all. It requires respect for every citizen in Northern Ireland, all communities and all traditions. And it's absolutely vital that, myself as a committed unionist in a government that is committed to the United Kingdom demonstrates that daily. And that is why appropriate action needs to be taken of the kind we've outlined earlier. Every day there are UK government officials, there are National Health Service doctors and nurses, there are people working in every aspect of government, working to serve the people of Northern Ireland as UK citizens. That is absolutely integral to the mission of this government, and I look forward to working with her and her colleagues to make sure that we move forward in the right way.
I'm suspending the House for 3 minutes to enable the necessary arrangements for the next business to be made. Order. I now call Secretary Matt Hancock to make a statement at his convenience. Secretary of State.
Thank you very much, Mr. Speaker. And Mr. Speaker, I rise to make a statement on the fight back against coronavirus. Across the country, our vaccine rollout continues at pace. With each vaccine we administer, we're one step closer to normal. As of today, we've vaccinated 9.2 million people. And I want to thank everyone involved in this collective national effort that saw nearly 1 million people get vaccinated last weekend alone. Or put it another way, 1 in 60 of all of the adults in the UK. We've now protected almost 9 out of every 10 people over 80 and half of people in their 70s. And I'm delighted that we've been able to visit every eligible care home, 10,307 in total. I want to thank everyone involved in that effort, including, of course, the NHS, our dedicated staff in social care, the residents themselves too for coming forward, and I want to pay tribute to my honourable friend, the Minister of State for Care, who's worked so hard to help us meet this ambitious target. I know that many of us in this House are playing our part in the national vaccination effort, and today we've published a new resource for the House that provides more information on the vaccine rollout and how all colleagues can play such an important part in increasing the take-up of the vaccine in their area. Because the take-up of this vaccine will directly impact how effective the vaccines are and how fast we can safely get out of this. Mr. Speaker, we're confident we have the supplies to meet our target to offer the vaccine to the 4 most vulnerable groups by the 15th of February. We now have over 400 million doses of vaccine on order, including the additional 40 million doses from Valneva that we ordered yesterday. And Mr. Speaker, that we find ourselves in this position is no accident. Our strategy has been to invest early and invest at risk. We've backed many horses, no matter where they're from, and we've also built up our vaccine manufacturing capability here at home. As a result, today, we have the AstraZeneca jab being manufactured in Oxford and Staffordshire and Wrexham, the Novavax vaccine made in Teesside, and the Valneva vaccine manufactured in Livingston in Scotland. It's a great example of what we can achieve together working as one united kingdom. Mr. Speaker, despite this optimistic backdrop, we must continue to act with caution, not least because of the renewed challenges posed by new variants of the coronavirus. We have found here 105 cases of the variant first identified in South Africa, including 11 cases which don't appear to have any links to international travel. As with the variant first identified here in the UK, there's currently no evidence to suggest it is any more severe, but we have to come down on it hard. Our mission must be to stop its spread altogether and break those chains of transmission. In those areas where this variant has been found, parts of Broxbourne, London, Maidstone, Southport, Walsall and Woking, we're putting in extra testing and sequencing every positive test. Working with local authorities, we're going door to door to test everyone in those areas, and mobile testing units will be deployed, offering PCR tests to people who have to leave their home for work or other essential reasons. We have also seen 11 cases of mutations of concern in Bristol and 32 in Liverpool, and are taking the same approach. In all these areas, it is imperative that people must stay at home and only leave home where it is absolutely essential. When your local authority offers you a test, you should take up the offer, because we know that around 1 in 3 people with coronavirus have no symptoms but can still pass it on. We're offering testing to everyone aged 16 and over, even if you have been vaccinated. And if you live in one of those areas but have not been contacted and you're unsure if you should have a test, I encourage you to visit your local authority website to find out. Anyone who must leave home to go to a workplace, for instance, because they cannot work from home, should get tested. All local employers should support and encourage their workers to get tested, and the message is more important than ever: to stay at home, maintain social distancing, and get tested. Mr. Speaker, across the whole country, we're expanding workplace testing. including here in Parliament itself. And this morning, you and I together visited the new COVID testing site here in Parliament, which offers all of those who work here, peers, MPs and staff, the chance to get tested. I took a test this morning, thankfully negative. It's quick and easy, and you get the result back fast. And I encourage colleagues who have to be here in person to sign up and do the same. And for all of us, no matter where we live, we need to continue to follow those rules, because while more scientific work is underway to learn more about new variants, we know with absolute certainty that social distancing works. It denies the virus the social contact it needs to spread. We must all keep at it. We've sacrificed too much and come so far with the vaccine to give it up now, and I know that we won't. Mr. Speaker, in closing, if I may say, while we've been working night and day to fight coronavirus, I have often drawn inspiration from our fight against another killer pandemic of HIV, a disease that also took too many people before their time. And this is HIV Test Week. It's a reminder of how important it is to get your free HIV test. But it's also a reminder of the progress we've made in tackling that terrible pandemic, that we can credibly commit to no new transmissions by the end of this decade. And today I'm sure the whole House will join me in wishing Lord Norman Fowler a very happy 83rd birthday. He was an inspirational former Health Secretary, a fearless advocate for tackling HIV and AIDS. Lord Fowler is someone who knows the importance of taking action early and the power of testing to turn the tide. So as we face these difficult weeks ahead, we can all draw inspiration from that great struggle, that even when faced with a mountain of challenges, science, ingenuity, and the sheer power of will can see us to better days ahead. And I commend this statement to the House.
Shadow Secretary of State, Jonathan Ashworth.
Grateful, Mr. Speaker, and grateful as always to the Secretary of State for advance sight of his statement. And can I thank you, Mr. Speaker, for putting in place the arrangements for testing on the estate. I'm sure members and crucially staff on the estate are extremely grateful for that initiative. Now, and I also extend my best wishes to the Lord Speaker as well on his birthday today. Now, the news that the South African variant has been identified in 8 different local authority areas is alarming and suggests significant community transmission. Can I just ask him to run through the timelines? Because when did these 11 cases test positive, and how long does the genetic sequencing take, and when was he told of these cases? And can these processes be made speedier? I'm told, for example, the Ealing case tested positive in late December. Now, these variants bring into focus the importance of border controls. Times Radio reports that hotel quarantine arrangements won't be in place until the 15th of February. Why the delay? And according to the Times newspaper, Sage warned 2 weeks ago tougher quarantine restrictions for everyone entering the UK were needed. The government disputes this interpretation, so will he publish the Sage minutes from 21st of January? I welcome the extra testing, but can I suggest he goes further? Because people move beyond their postcode boundaries. They go shopping. Many still have to go to work. Will he therefore roll out testing in neighbouring postcodes? He wants to come down hard on this variant, but isn't the lesson of mass testing, such as in Liverpool, that people are hesitant to take a test if they aren't compensated for any loss of income associated with self-isolation? We are fighting this virus with one hand tied behind our back, asking the low pay to go hungry in order not to spread the virus. Transmission chains won't be broken without decent sick pay and isolation support. We've seen the Kent B777 variant spread with speed. Now, Public Health England's latest technical briefing reports that the B117 sequences with the E484K mutation seen in the South African variant, and this has now been identified. This is very worrying because it's this mutation which is thought to be behind the partial vaccine evasion. Surely this suggests that further action is going to be needed. So, for example, Germany, Austria and France are recommending FFP2 face masks on public transport and shops. I mean, the chair of the Select Committee has also suggested this. Will he now review the evidence and look at this? And on vaccination, I again congratulate the NHS. Now, not all care homes have been vaccinated. Those with a COVID outbreak have not been vaccinated for understandable reasons. But could he tell us how many of these care homes are outstanding? And there have been reports of some care staff turning down vaccination. So can he tell us how many care staff have been vaccinated? And will he ensure the NHS collects data on the numbers turning down vaccination so we can target and overcome vaccine hesitancy more effectively? Public health services have an important role in tackling vaccine hesitancy. When will public health directors know their allocations for the next financial year? And Mr. Speaker, UNICEF have warned that children are not the face of this pandemic, but they risk being amongst its biggest victims. Now, I accept it was inevitable that schools would close given community transmission levels, but that doesn't make it any less devastating. We're depriving young people of social interaction, of play with their friends. Learning is not the same. Mental health problems are increasing. There'll be children in homes where there is violence or drink abuse or substance misuse prevalent. Children's health must always be a priority. So on current plans, how many teachers will be vaccinated as part of bands 5 to 9? And how many teachers and support staff will have to wait until the period between Easter and summer to be vaccinated? Last September, it was reported 25,000 teachers had been off sick related to COVID, further disrupting children's learning. So how can he ensure we don't see the same disruption again from March when it's hoped schools return? Finally, Mr. Speaker, this is indeed HIV testing week. And over the weekend, I binge-watched It's a Sin. And I was in tears. Mr. Speaker. Now, thankfully, HIV is not a death sentence today. People living with HIV are in phase 6 for vaccination, but only if they have disclosed their HIV status to their GP. Many haven't and still don't want to because of the stigma we saw portrayed in It's a Sin. So will he ensure that people living with HIV are able to access vaccination at their HIV clinic?
Secretary of State.
Thank you very much, Mr. Speaker. And just to answer the honourable gentleman's many questions, he's absolutely right to raise the importance of of coming down hard on the cases of new variants that we've discovered here in the UK. And these are cases that have been seen over the past 2 months. And the action that we're putting into place is action to make sure that we stop further spread and further spread in the community, alongside the action taken to ensure that there's no spread from those who have got a history of international travel. As he knows, we brought in tougher action at the border, and we stand ready to do more. He asked for the SAGE minutes to be published. They are published regularly. And he also asked for the neighbouring postcodes to those postcodes where a new variant case has been found, where it's a new variant that is a variant of concern. We absolutely do that where it is epidemiologically sensible. So, for instance, if the case is found on the border of a postcode, obviously we go across that border. And we also investigate linked premises. For instance, if somebody had a child at a school or is going to work in a particular workplace, and then working with the Director of Public Health, we will ensure that testing is directed there as well. He raises the issue of isolation payments, and we have the £500 isolation payment in place. So nobody need, as he put it, and nobody should go hungry because they have to isolate. What is critical in these areas is that people stay at home unless they absolutely have to. It is imperative that people follow the rules to get these new variants completely under control. He asked on the care home success. I'm delighted that we've been able to reach so many care homes. I said in my statement that we have reached 10,307 care homes. That's in England. There are 110 care homes where the vaccination programme is still outstanding because they've had outbreaks, and for clinical reasons the vaccination programme can't start there, but it will as soon as it's clinically possible. He also asked about the data being shared from the vaccination programme. That data is now routinely shared with local directors of public health, precisely for the reasons that he sets out, so we can reach more parts. And finally, he ends on the question of education. And of course, we understand how challenging the impact of this lockdown is on those with children who have to be schooled at home. And that's why the Prime Minister has said that schools should be the first thing to open when it is safe and possible to do so. Sadly, that time isn't yet, but the more that we all follow the rules that we've set out so clearly, the quicker that time will come.
Video link to the Chair of the Health Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker, and can I thank the Health Secretary for liaising with me on the issues in Surrey over the weekend, where the actions taken by him and the outstanding leader of Surrey County Council, Tim Oliver, are absolutely right. He mentioned that at the weekend we reached the milestone of offering the vaccine to everyone in care homes except for where there's been an outbreak. Does he agree that we should crown that tremendous achievement by making 2021 a year as significant for the social care sector as 1948 was for the NHS when it was founded, with a long-term financial settlement, implementing DIL not, and setting it up for the future with a 10-year plan?
Well, Madam Deputy Speaker, my right honourable friend knows that we set out in our manifesto, committed in the manifesto, and were elected on a manifesto to resolve the long-standing problems in social care. The Prime Minister has set out to the liaison committee, of which he, of course, is a member, the timetable on which he hopes that we're able to deliver on that commitment. Alongside dealing with this pandemic, Madam Deputy Speaker, we are working to deliver our manifesto commitments, whether it's on social care or the 40 new hospitals or the 50,000 more nurses. And I look forward to being held to account by the Select Committee on those commitments.
Video link to the SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Madam Deputy Speaker. I would like to associate myself with the Secretary of State's comments on HIV Test Week. But it's very concerning to hear that over 100 cases of the South African variant have been detected in the UK, particularly as they don't represent a single outbreak, but are widely scattered across England. The concern, of course, is that while current vaccines will still give a significant degree of protection, this variant's resistance to some COVID antibodies could reduce their effectiveness. So does the Secretary of State plan to tighten internal travel restrictions to avoid it spreading across the UK, as happened with the Kent variant? And will there be increased random genomic testing of PCR specimens out with these areas to identify just how widespread it already is? Unfortunately, this is shutting the barn door after the horse has bolted. The government has been aware of the concern about this variant for some time, and the SAGE advisory group warned that limited travel bans wouldn't be enough to keep out new COVID variants, and the only way to stop them would be mandatory quarantine for all arrivals. So why did the government choose not to follow this advice? This variant is already present in many countries, and new, more resistant COVID variants could evolve anywhere in the world. So will the government now reconsider their very minimal quarantine plan and extend it to all incoming travellers? And finally, as new strains brought in through holiday travel last year contributed to the second wave of COVID, is the Prime Minister seriously suggesting people should go abroad on holiday this summer?
Well, thank you very much, Madam Deputy Speaker. I think what the SNP spokeswoman failed to mention is that it's only because we built the huge genomic surveillance capacity that we now have that is available right across the UK that we've been able to spot these variants of concern. And this is a critical point because these sorts of variations happen everywhere, but the challenge is to spot them as soon as you can and act on them. She asks about travel, and we've already in place rules against all non-essential travel with a clear stay local guidance. And we also have mandatory isolation for new arrivals. So yes, we have tightened in response to the new evidence that she mentions. But she didn't also mention the fact that it is only because the vaccine programme is rolling out so rapidly across the whole UK that we are able to protect people against the old variant, which of course is the most widespread, the combination of the old variant and the variant first discovered in Kent. And that is the way that we will get out of this, this situation. That is a UK programme, and we are enthusiastic and willing, from the UK government point of view, to do everything we possibly can to support that rollout, including all the way across Scotland, to make sure that people in Scotland and every other part of this United Kingdom can get their jab as soon as possible.
Video link, Robert Helfen.
Thank you, Madam Deputy Speaker. I pay tribute to my right honourable friend and the Vaccinations Minister for the work that you have all done on vaccines. Will my right honourable friend thank Essex Council, NHS staff and volunteers in Harlow who have so far vaccinated many thousands of residents. Public Health England have said that adults over 18 with learning disabilities are at greater risk of dying than most people aged 65 to 74. International studies show that if you are learning disabled aged 55 to 64, death rates are comparable with those over 80. My right honourable friend will have seen the parliamentary petition on this signed by many thousands. So will he work with the JCVI to move the adult learning disabled high up the priority list for vaccinations?
Could you state?
Well, thank you, Madam Deputy Speaker. I pay tribute to all those who are working in Harlow, including at the Harlow mass vaccination site, and also the GPs and the pharmacists who are working so hard to vaccinate people right across Harlow. On the question of the JCVI ordering and the prioritisation for vaccination, as he knows, I think the best approach is to take the clinical advice and to follow that clinical advice. The sorts of considerations that he raises are an important part of the JCVI deliberations. I know they've looked very closely at the subject that he raises. What matters now that they've made and published their decision, is that we drive through the vaccination programme to get through as many of those groups as possible. And I'm very pleased to see the hundreds of thousands of new vaccinations that are taking place every day.
Video link, Dame Angela Eagle.
Thank you, Madam Deputy Speaker. Sage warned about the dangers of the South Africa strain weeks ago, but the Prime Minister dragged his feet, and he's now decided on a partial quarantine arrangement that Sage has already warned will be ineffective in preventing further introduction of this variant. So isn't it the case that once again the government have acted too little and too late to stop the spread of this new and dangerous variation in the UK?
No, on the contrary, we removed the travel corridors to ensure that there is a self-isolation requirement that is mandatory for all those who are coming to this country, and protecting this country from new variants coming from abroad is important. Hence, we've taken the action swiftly, and we did that on the basis of the scientific evidence.
Philip Hollowbone.
Could I commend the Health Secretary for the difficult, brave, but correct decisions he made early on in the pandemic in relation to vaccines, which has led today to Britain having a world-leading vaccine rollout. And could I also draw his attention to NHS Northamptonshire, which, thanks to the very hard work of all the local staff and volunteers, has one of the very best vaccine rollout programmes in the whole country.
Yeah. Yes, I've been watching the progress of NHS Northamptonshire, who are going great guns, and I know they're working incredibly hard. This doesn't happen by magic, it happens by hard graft, and especially the GPs and the pharmacists and the support teams and the volunteers who are doing such a great job in Northants. And I'm very grateful, Madam Deputy Speaker, to what my honourable friend said. We did take decisions at risk early, before we knew whether they were going to come off, knowing that we'd be criticised if it didn't work out, but that meant that we could get those contracts signed ahead of many other places, and it means that we will be able to deliver vaccines for UK citizens and then, of course, play our part in ensuring that everybody across the world can have access to this life-saving vaccine too.
Video link, Zara Sultana.
Thank you, Madam Deputy Speaker. The government's catastrophic mishandling of the virus has meant that in the past month, there were over 32,000 COVID deaths in the UK, an average of more than 1,000 a day. In New Zealand, there was 0, in Vietnam, 0, Australia, 0, in Taiwan, there was 1. The difference, these countries pursued a zero COVID strategy, suppressing cases, saving lives, and reopening economies. The vaccine offers hope, but so long as the virus circulates, there is a risk of thousands of more deaths and now more dangerous new variants. So does the Secretary of State regret his government's decision not to pursue a zero COVID strategy, and will he now commit to this strategy?
All countries that have attempted a zero COVID strategy have found that this virus transmits and it gets round the boundaries that have been put in place. There were parts of this country that tried a strategy of zero, and in fact we were urged to do so in this House. But what matters is making sure that you get the tools that are going to be used permanently for us to get through this, and we get them deployed as fast as possible. And that means testing with the hundreds of testing sites that are now available, and crucially, it means getting this vaccine rollout. She said the vaccine offers hope, and I think that is where we should all focus, on getting this vaccine rolled out as quickly as we possibly can.
Rob Roberts.
Thank you, Madam Deputy Speaker. The Betsy Cadwallader University Health Board in North Wales has had some difficulties over a number of years, and it wasn't surprising, therefore, that there was a collective sharp intake of breath and mutterings of "here we go again" when the vaccine got out to a little bit of a faltering start in North Wales. My colleagues from these benches and I have been in constant contact with the Health Board, and are pleased to report that now things are back on track. They're making really good progress, and they're very, very confident of being able to hit that target of the first 4 groups by the middle of February. My right honourable friend, therefore, join with me in paying tribute not only to the staff of the Health Board, but also the legions of volunteers, the Army forces, and all of the people who are involved in that, who are doing such a fantastic job in North Wales.
Will, it's close to my heart, Madam Deputy Speaker, and I think that right across this UK, people have done extraordinary things and worked incredibly hard to deliver this vaccine rollout, and we've been working as hard as we possibly can as a united kingdom to support the NHS in Wales, in North Wales, for my honourable friend, in Scotland, in Northern Ireland, to make sure that this vaccine is delivered as safely and as rapidly as possible to all parts of these islands.
Dan Carden.
Thank you, Madam Deputy Speaker. And it's wonderful to see so many people being vaccinated so quickly, and it shows the value of investing in the right people, in the right place, at the right time, and using our National Health Service, GPs and local public health professionals. But the vaccination isn't the end of the story. Social distancing will continue to play its part, so will test, trace, isolate and support, and of course new variants threaten to take us back to square one. So can I ask the Secretary of State to learn from the obvious lessons from this government's failures and successes, put local health teams in charge of test and trace with the proper funding that they need, but also fix the broken system of support, the £500 payments and those not entitled to statutory sick pay as quickly as possible.
Well, Madam Deputy Speaker, I take all that as a compliment. The £500 payment is incredibly important for supporting people on low incomes. The huge rollout of test and trace, the fact that now over 90% of contacts are identified and contacted by NHS Test and Trace, who are doing a magnificent job, and of course the rollout of the vaccine, which is going so rapidly. The fact that this weekend 1 in 60 of all of the adults in the country got a jab, I think, is a testament to that. So we absolutely always are looking to improve and to learn lessons wherever we possibly can. But I'm really glad that things are making the progress that they are.
Steve Brown.
the Secretary of State said about HIV, and binge watching It's a Sin is 5 hours well spent, and a reminder of how close we are to that magic zero transmission. And the government's acceptance last week that the release of our society, rightly starting with our schools, should move in lockstep with the success of vaccine rollout was really welcome. But can the Secretary of State assure parents that we will follow an increasing number of countries around Europe and indeed in the UK and stick to that as the vulnerable groups and those liable to overwhelm the NHS are protected?
Yes, of course.
Video link, Munira Wilson.
Deputy Speaker, with the Prince's Trust reporting a record high of more than half of young people often feeling anxious, and some A&Es reporting daily seeing children coming in with self-harming and overdosing, it's clear that the pandemic is taking an enormous toll on children and young people's mental health and well-being due to school closures, family pressures, social isolation and bereavement. So will the Secretary of State commit today in Children's Mental Health Week to urgently forming a cross-departmental plan for tackling the impact of the pandemic on children and young people's mental health?
Well, Madam Deputy Speaker, we have put a significant amount of extra funding into supporting children's mental health alongside adult mental health, as we know that one of the consequences of the lockdown, which is absolutely necessary, is that it does put significant pressure, and we have seen the increased burden on mental health services, and it's very important that people get the support they need.
Mark Harper.
Very much, Madam Deputy Speaker. Can I just add my congratulations to those that have been rolling out our vaccine? I listened carefully to what my colleague from Northamptonshire said, but can I just put on record my thanks to those in Gloucestershire, which as of last Thursday was the top performing part of the country, and Hereford and Worcestershire next door was the second highest performing, which kind of makes them the highest performing rollout in the whole of the Western world. So can I thank the Secretary of State for his help and that fantastic performance. Can I just take him back to his answer to my honourable friend, the member for Winchester? The whole point of this vaccine rollout is to make sure that we protect the vulnerable, reduce the death toll, and reduce hospitalisations and the pressure on the health service. Given the vaccine rollout's going so well, and ahead of where I suspect the Secretary of State thought it would, can I ask him to confirm that on March the 8th, when we start seeing schools going back, that it'll be those two metrics, deaths and hospitalisations, as they fall, which will guide the reopening, not just of schools, but of the rest of the economy?
Thank you very much, Madam Deputy Speaker. Well, the Prime Minister has set out 4 metrics that we will follow. Deaths and hospitalisations are 2 of them, and they are both incredibly important. We expect deaths to fall faster than hospitalisations because you tend to get, because older people who are higher up in the right cohorts by the JCVI are more likely to die by a greater degree than they are more likely to use hospital beds. And then the other 2 considerations are that we don't see further new variants that put all this at risk, and of course that the vaccination programme rolls out well. I wouldn't say that the vaccination programme is ahead of plans. I would say that it is on track. I make no further claim than that.
Jim Shannon.
I thank the Secretary of State for his and his department's wisdom and forethought for securing the vaccine for all of the United Kingdom of Great Britain and Northern Ireland. Better together. Always say that, it's the truth. As some members will remember, the last smallpox outbreak in the UK was in the 1970s and was combated by health workers going door-to-door testing. I understand the rationale behind this decision, but can I ask the Secretary of State, what discussions have been had with the Treasury to secure additional financial support to enable each devolved administration to carry out similar schemes if the need arises in every part of the United Kingdom of Great Britain and Northern Ireland?
Yes, thus far we of course stand ready to put in place financial support for the devolved nations, should that be needed, in order to tackle outbreaks like this. We have a constant conversation with the devolved authorities, and I speak, for instance, to Robin Swan, the Health Minister in Northern Ireland, on a regular basis. I was talking to him on Saturday morning, about supply of vaccines, as the honourable gentleman might imagine. So it is something we work very closely together on. But the fundamental point that he makes, Madam Deputy Speaker, is absolutely right, that it is by working together as one United Kingdom that we're managing to do this on vaccines. And if you want a shining example of why this country performs so well when we work together, just look to the vaccines programme being rolled out in every corner of the country, in every locality, with all nations working together in a single combined mission. It is a celebrated example of why this country works well when we're better together.
Sir Graham Brady.
Thank you very much, Madam Deputy Speaker. Can I thank my right honourable friend for repeating his commitment to ensuring that schools can get back as soon as it is safe to do so. But as he reflects on that, can I ask him to keep in his mind the very sobering words of Professor Russell Viner, the President of the Royal College of Paediatricians, who said to the Education Select Committee, when we close schools, we close children's lives, and then went on to refer to 75 international studies which suggest significant mental health damage for children. And will he reiterate the huge importance that there is in putting children's mental health and well-being alongside the other onerous responsibilities that he bears?
Secretary of State.
Yes, I agree entirely with my right honourable friend. The Royal College of Psychiatry have been very clear in describing the negative impact of school closures and also the negative impact of the virus getting out of control. The challenge we have is to try to mitigate both of those problems, and it is the vaccine that is the best way through.
Video link, Ruth Jones.
Thank you, Madam Deputy Speaker. And I want to start by thanking our amazing NHS staff, especially those working in the Aneurin Bevan Health Board here in South East Wales, for their amazing work throughout this pandemic. Can I ask the Secretary of State to update the House on any conversations he may have had with the pharmaceutical companies about the need to modify the vaccine in the light of the new variants?
Yes, we're working with pharmaceutical companies and with the scientists to understand both whether such modifications are needed, where they are needed, and how they can be brought to use on the front line as quickly as safely possible. This is obviously a very important consideration given the new variants that we've seen, and we have confidence that modifications to vaccines, should they be necessary in large scale, will be available in more quickly than the original vaccines. And just as we did first time round, when we got in there early and we bought at risk, so we are having exactly the same conversations right now with the pharmaceutical companies to make sure that we are right at the front of this one.
Video link, David Morris.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, there have been scare stories in Lancashire of a shortage of vaccines due to these vaccines being diverted elsewhere in the country, causing this shortage and perpetuating further urban myths. Can my right honourable friend, the Secretary of State, assure me and the House that my constituents in Morecambe and Lunesdale are going to be covered and that we're not seeing vaccines being redirected to other regions of the UK, and Lancashire will continue to receive the required proportions in the future, safeguarding my constituents?
Yes, I can give my honourable friend that absolute assurance. Of course, the supply of vaccines is the rate-limiting step. And we've seen from some of the things that have happened over the last week just what the strain is on vaccine supply. And some weeks the supply is higher than others. And you can see on the website the daily move in the overall supply across the country as a whole. But Lancashire will get its fair share. It will get enough to be able to deliver the target of the offer to everybody in cohorts 1 to 4 by the 15th of February. I've looked very closely specifically into the figures for the North West, and the North West is getting its fair share. And the reports circulating on the internet do not come from credible sources, and I can hope that I can give my honourable friend that assurance.
Video link, Clive Efford.
Deputy Speaker, I would like to add my congratulations to the workers in the NHS who are delivering the rollout of the vaccine. Reopening schools is going to be a major step towards returning to some form of normality, particularly for the young people. But the presence of the new variant is likely to create some anxiety amongst staff. And so in order to minimise the disruption to education when we return and create some confidence amongst the staff when that moment comes when they're asked to go back into schools in large numbers, does the Secretary of State agree that we should be now planning to vaccinate staff members of schools and to do so, if at all possible, before half term, if not during?
Well, the challenge with the proposal that the Honourable Gentleman puts forward is that vaccinating those who are not as vulnerable to this disease before those who are more vulnerable means that you are essentially increasing the overall clinical vulnerability to this disease. I'm glad that the Honourable Gentleman, the member for the Labour front bench opposite, did not raise this issue from the health part of the Labour front bench. I know others on the Labour front bench do. But we do have to follow clinical order of priority because my priority is saving lives.
Video link, Julian Sturdy.
Thank you, Madam Deputy Speaker. Further to the Prime Minister's suggestion yesterday in Batley that we may not see a return to different regional tiered restrictions due to the virus's behaviour, how will the government avoid unfairly disadvantaging areas with low COVID rates if they go ahead with this approach? Or does the fantastic vaccination programme rollout mean that the whole country can make steady progress out of lockdown together now?
That is our goal, that the whole country can make steady progress together. And in fact, if you look at the case rates across the UK, they are more similar in all parts of the UK than they have been for some time. And of course, there were significant regional variations over the autumn, but that is much less widespread now. Hence the comments that the Prime Minister made yesterday.
Video link, Julie Elliott.
Thank you, Madam Deputy Speaker. The Secretary of State will know that I have written to him several times recently on the subject of the gut microbiome, which the immune system heavily depends on, and its impact on COVID-19. Will the Secretary of State meet with me to discuss the emerging research, including the use of pre- and probiotics, positive mitigation on the impact of the worst effects of COVID-19, helping people suffer less, saving the NHS money?
I'm very happy for either me or one of my team to meet with the Honourable Lady to discuss this issue and make sure it's looked into properly.
Video link, Dr. James Davis.
Thank you, Madam Deputy Speaker. Development, production and rollout of vaccines in Britain is increasingly envied across the world. Lockhart factory in North Wales playing its part in the process. What plans does my right honourable friend have to increase the production of vaccines in the UK further, both to meet our own needs and to allow us to assist our friends in the Republic of Ireland and elsewhere?
Absolutely. The onshoring of vaccine manufacturing is an incredibly important part of our strategy. We were previously very, very good at the research, indeed very good at the regulation of vaccines, but onshore manufacturing was sparse. We've built that manufacturing capability, including at Wockart and on the Wrexham Industrial Estate, as he mentioned, but also now with production in Scotland, in Teesside, and elsewhere, with more to come. And I think it is a strategic choice for this country that we should make, that we should bring onshore the manufacturing of critical industries and critical products like vaccines, not least because there isn't going to be a global glut of vaccine manufacturing capability for a long time to come. And we are at the forefront of the science. We should be at the forefront of the manufacturing and the production too.
Video link, Alison Thulis.
Thank you, Madam Deputy Speaker. Dr Wendy Jones, who operates the Drugs in Breast Milk Helpline, continues to be getting queries from people who've been told that they can't get the vaccination if they are breastfeeding. So could I ask the Secretary of State, could he make it absolutely crystal clear that this is not a contraindication for people being vaccinated, and that those who are breastfeeding should get the COVID vaccination?
Madam Deputy Speaker, I will ensure that the Chief Medical Officer writes the Honourable Lady setting out the precise clinical details of this point, because whilst she is right, I don't want to opine on the clinical points. I want to make sure that comes from the top doctor in the land.
Matt Vickers.
Thank you, Madam Deputy Speaker. A huge debt of gratitude is owed to all those involved in our incredible world-leading vaccination programme, including Teesside's Hospital, Primary Care Network and Fairfield Pharmacy, which was one of the first pharmacy-based vaccination hubs around. Can my honourable friend confirm when Teesside will benefit from a mass vaccination site so we can get more jabs into the arms of Teesside as soon as possible?
I think the performance of people on Teesside in getting the jab rolled out so fast has been absolutely magnificent, particularly, but not only in Stockton-on-Tees, and I'm not just saying that because the honourable gentleman asked me the question. It has been a really, really impressive performance, and I'm very happy to look into when we might be able to open a Teesside mass vaccination centre, but what I can say is that across Teesside this rollout is going well, and I'm grateful to everybody who's coming forward so enthusiastically to get the jab.
Video link, Tony Lloyd.
Thank you, Madam Deputy Speaker. Can I join with the Secretary of State in congratulating those in my own constituency who've worked so hard to roll out the vaccine? But at the moment in Rochdale, as in other areas, the people are given roughly a week's notice of the quantity of vaccine and also of the type of vaccine. And as a way of working, that is fine for the first round of vaccinations. When we come to the second round, can there be flexibility built in so that those who are responsible for delivering the vaccine know what vaccines they'll get, how many they'll get, so they can ensure that those second vaccines are the ones that are needed?
I absolutely understand the point that he makes, and I join with him in what he says. And I understand why people who are delivering the vaccine on the ground want to know these forecasts. The challenge is that the supply schedule is lumpy, and hence we don't want to give inaccurate certainty. We don't want to imply that there is a certainty where there isn't. Where there is certainty is that we have a high degree of confidence that the second doses will be available and of course will be distributed according to need with the right vaccine for the right second dose going to the right place. We have a full record of that. The second dosing starts in earnest in a couple of months' time, obviously 12 weeks on from the 4th of January when we shifted the dosing schedule to a 12-week schedule. And we have the logistics underway to ensure that people get access to the right dose to match the first dose that they had. I'm very happy to talk to him further if he has any further questions about the logistics of getting this sorted.
Video link, Jason McCartney.
Thank you, Madam Deputy Speaker. Over 400 people were vaccinated at the new pharmacy-led vaccination centre at Honley Village Hall yesterday. And the new vaccination centre at the John Smith Stadium in Huddersfield is also open too, as Yorkshire continues to lead the way with the vaccine rollout. Will my right honourable friend join me in thanking our NHS, the independent community pharmacy involved, and our wonderful community volunteers who are all part of this great national effort?
So will, Madam Deputy Speaker, the vaccination effort in Yorkshire has been absolutely fantastic, and right across Yorkshire, from West Yorkshire, where my honourable friend represents, including in South Yorkshire, Madam Deputy Speaker. Yorkshire has just absolutely pulled this one out of the bag, and we're going to deliver on that offer to everybody in the top 4 vulnerable categories by the 15th of January, just under 2 weeks, and then we're going to get on and vaccinate all the others who are in the vulnerable cohorts. I know it's hard work, but it's also so uplifting. And I'm really, really glad to see that happening right across Yorkshire.
Video link, Tonya Antoniaza.
Madam Deputy Speaker, in answer to my written question to the Home Office, I was informed that Border Force do not hold records of the number of staff that have tested positive for COVID-19 in the last 12 months. We've seen the DVLA in Swansea unable to give the Transport Select Committee the correct number of staff who tested positive for COVID-19, let alone a breakdown by department. What conversations is the Secretary of State having with his Cabinet colleagues and government agencies to ensure the safety of essential civil servants who are unable to work from home?
We are having these conversations all the time. In fact, I spoke to both the Home Secretary and the Transport Secretary about this issue yesterday, ensuring that we have widespread workplace testing available for all civil servants right across the UK.
Nusrat Ghani.
Deputy Speaker, I come with good news from Wilden. The vaccination programme is working at a fantastic pace in my care homes and across the constituency, and I'm coming with thanks to my right honourable friend and to his leadership, and that is coming from lots of people across Wilden, so thank you so much. But a minister's job is never done. So now I'm being flooded by messages from parents and grandparents and teachers. They want no more further delays to school openings, so any assurances will be welcome. And can I ask my right honourable friend, because we know that the lockdown has had an impact on our children's mental health and educational attainment, is research being undertaken in the department so we can be ready to offer full wraparound care when lockdown is over for our young people?
Just before the Secretary of State answers, just a gentle reminder that we've still got almost 25 people to go, so probably brief questions and answers. Secretary of State.
Well, of course, Madam Deputy Speaker, we do want to provide as much support as is possible, and I'm really glad to see that the vaccine rollout is going well in the Wilden, and I want to thank everybody who is playing their part in that.
Video link, Ben Bradshaw.
Why doesn't it make sense, Madam Deputy Speaker, for teachers and other essential frontline workers to be vaccinated before perfectly fit and healthy people like us, Madam Deputy Speaker, in their 60s?
Because, Madam Deputy Speaker, people in their 60s are more likely to die from COVID than people who are younger.
Adam Afriri.
Thank you. Thank you very much, Madam Deputy Speaker. Our world-leading vaccines programme will mean that deaths and hospitalisations for serious ill health will fall massively, probably to normal levels, by about the 8th of March, when the top 4 priority groups are vaccinated. And our top priority must be, and I'm glad to hear the Secretary of State confirm it, to open our schools first and then move on. Because our parents are desperate to have the schools opened, the teachers want the schools opened, the businesses want the schools opened, and God bless them, even our children are desperate to have the schools opened. So will my right honourable friend confirm that schools will be the first to reopen on or before the 8th of March?
I can confirm what the Prime Minister has set out, that the schools will be the first in the queue for reopening, and we will consider the data in the middle of this month, and my right honourable friend the Prime Minister will set out a statement after that, and we will give 2 weeks notice, and so the schools will not open before the 8th of March, and of course we'll look at the data as I set out in the previous answer.
Video link, Kyle Williams.
Thank you. The Health Minister in Wales has now admitted at last that many lives could have been saved had the Welsh Labour government locked down sooner last year. Madam Deputy Speaker, does the Secretary of State also believe that an earlier general lockdown in England would have saved many lives? And if so, how does that belief inform the quarantine and lockdown decisions his government now faces?
Well, we have taken action very rapidly when we've seen rises in cases. And the most recent example here in England was, of course, right at the start of this year, when we saw the sharp spike in cases and took very rapid action to close schools after some of them had been open for just one day. We don't take these measures lightly at all. We understand the impact that they have, but they were absolutely necessary.
Thank you very much, Madam Deputy Speaker. Can I congratulate my right honourable friend and the entire team for doing such a phenomenal job in rolling out this life-saving vaccine right across the country. But it's not in our interest to, or indeed our character, to become a vaccinated island. We both have the means and the desire to help others who don't have such advanced public health infrastructure systems such as us. And I know that we're heavily involved in COVAX and Gavi and encouraging global vaccine disbursement, but could I invite the Health Secretary to go a step further and work with the Defence and Foreign Secretaries in allocating overseas funds to create an international vaccination task force, utilising our RFA Argos, our hospital ship and other military assets to practically assist with the international rollout of vaccines to developing countries. The UK set an example by stepping forward during the Ebola crisis. I hope we can do the same again today.
I'd be very happy to talk to my right honourable friend, the Defence Secretary, about this idea, because we are leaning into the global vaccination effort, not just with the funding that he mentioned to COVAX and Gavi, but also with practical support, including, of course, the Oxford vaccine itself, which is the most deployable vaccine and the only vaccine currently being used that has been distributed at cost. AstraZeneca took the decision to license the Oxford vaccine at cost right around the world, rather than making a profit on it, and I think they should be commended for that.
Video link Chi Anwara.
Thank you, Madam Deputy Speaker. 1 year after the UK's first COVID patients arrived at Newcastle's Royal Victoria Infirmary, I know the Secretary of State will want to join me in congratulating Newcastle's NHS staff, GPs, public health professionals, volunteers, and all leading the way in vaccinating so many so quickly. And will he agree to reward such success by handing more resources and control over the failing test and trace programme to local public health teams who are closer to communities and can better understand local transmission chains and need to, if we are to get the virus under control?
Secretary of State.
Yes, absolutely. Local authorities are critical to this, and we're working with Directors of Public Health as part of the effort.
Video link Mark Eastwood.
Thank you, Madam Deputy Speaker. Yesterday, I had the pleasure of meeting the Prime Minister at the Al Hikma Vaccination Centre to highlight the importance of people from local communities accepting the offer of a vaccine. What message could my right honourable friend give to the people of Dewsbury, Mirfield, Kirkburn and Denby Dale, who may be thinking twice about having an inoculation when given the opportunity?
I would say to everybody that they should listen to the Honourable Member, their local representative, and all those who've looked at the impact of this vaccine, and we can see that it saves lives, and we can see that it is safe to take, and we can see that the rumours that are spread on the internet are just that, they're rumours, they're not facts. And I would listen to local faith leaders too, from churches and mosques and synagogues right across the country, who are all uniting in saying that we should take the jab when it's our turn. It's the right thing for you, and it's the right thing for your community.
Video link Bill Esterson.
The Health Secretary will understand the concern about the discovery of the South African variant in the borough of Sefton. But I wonder if he can tell us what the variant is that he referred to with a number of cases in Liverpool. He also knows that a number of times I've raised the concern about the number of people who cannot afford to self-isolate or to stay at home. This is even more important now with the spread of new variants and of mutations. So will he tell me now that he is going to push his cabinet colleagues to plug the gaps in financial support so that everybody can play their part and stay at home to stop the spread of the virus?
We have put in place the £500 support to ensure that everybody can afford to self-isolate. On the question of the South African variant that has been discovered in Southport, I would say that we are putting in place very significant action with the local authority to try to isolate that case and any spread, and it is vital that all members of the community play their part, stay at home and get a test when it's offered by the local authority. And there's more information on the Sefton website, and I will pay tribute to the MP for Southport, our colleague who wasn't able to get on the call list, with whom I've been corresponding on this, and he's been playing an important part along with the Honourable Gentleman. The cases in Liverpool that I mentioned were in fact raised in the local media and described by Liverpool Council a couple of weeks ago, and I included them for completeness to describe all of those cases where we have seen a mutation, along with the 11 cases in the Bristol area that we have that I also described that have been set out in a scientific study from the University of Leicester today. Liverpool City Council, we've been working very closely with Liverpool City Council and with Bristol City Council on these two clusters, along with the councils of all those where a variant of concern, for instance, like the South African variant, has been found. I hope that's a complete enough answer, and I'm very happy to talk to the Honourable Gentleman if he has any further questions.
Bob Stewart.
Thank you very much, Madam Deputy Speaker. Yesterday I was speaking on the telephone to Mrs. Bunny England, who is a WAF in the Second World War, and at 92, very, very young. She tells me she's housebound and no one's contacted her about a vaccination. I assured her that I would inform the quite excellent and responsive South East London CCG about her case, and I'm sure she would be contacted very quickly. Could I ask my right honourable friend, who's doing extremely well, how are we going to be able to get to every single person who's housebound in groups 1 to 4 by the 15th? Yeah,
well, I would say that that Mrs. Bunny England is certainly going to get her jab now, and I'm very grateful to my honourable friend for raising her case, and I'll get straight on to the CCG, who, as he says, is excellent, and we have, of course, roving teams right across the country going to people who are housebound. It's very, very important that we reach all with that offer. And we're on track to ensure that everybody can have the offer of a vaccination by the 15th of February. I appreciate that for somebody in their 90s, they may have been waiting for that call for a couple of weeks now, but we are making good progress, and I'll make sure that Mrs. England gets her jab.
Well done,
Video link, Asfal Khan.
Thank you, Madam Deputy Speaker. Last week, I visited a number of new pharmacies-led vaccination centres set up in my constituency. It was incredible to see the tireless hard work of staff and volunteers. These vaccination centres are struggling to navigate the confusion caused by the 2 online booking systems. They are seeing patients being sent to centres much further away rather than staying local. And patients over 70 who cannot get an appointment as the national booking system does not update in line with the government guidance. Will the Secretary of State look into these issues with some urgency?
Well, first, Madam Deputy Speaker, can I pay tribute to the Honourable Gentleman's leadership in his local area and in his community for demonstrating how important it is to get the jab, as so many colleagues across the House are doing. I think it's wonderful that we have this total unanimity in this House on the importance of the vaccination programme and the work that people are doing from all sides of the House and from all backgrounds in promoting the vaccination effort. It really makes me very, very proud, and it's humbling. On the specific issue that he raises, of course, I'll look into that. I'll ask the Minister for Vaccine Deployment to call him to talk specifically about the issue. Now, there are two different routes that you can get a jab, either the mass vaccination centres or through the GPs, and people are often invited to both, and that's okay. They can take one or the other, whichever is most convenient. If they get an invitation to a vaccination centre that's a bit of a distance and they want to wait for a closer one, then they can do so. That closer invitation from the local GPs will come. And a lot of people appreciate the opportunity to essentially go as soon as possible. That's why we've got these two different routes. But I understand the importance of making that clear to everybody and making sure they're deconflicted as much as possible. And I hope that we can make sure this goes as smoothly as possible, and that he and Minister Zahawi can make that work.
Video link, Andrew Griffith.
Thank you, Madam Deputy Speaker. Sussex today reached the twin milestones of vaccinating 85% of its over 80s and every care home, bar the small number with recent outbreaks. Will the Secretary of State join me in thanking all involved, including Siobhan Melia, Adam Doyle and their teams in NHS Sussex, all the many GPs and the army of volunteers in Arundel and South Downs?
Absolutely. I'm very happy to congratulate everyone in Arundel and South Downs and across Sussex who've done a magnificent job so far. There's a lot more still to do, but they're doing a great job. And I particularly want to pay tribute to those who volunteered their time. And often, you know, for instance, can end up on a shift 8 hours standing in the car park in the cold. But just the spirit that's being shown in Sussex and right across the country is really uplifting, and we all need something that's uplifting in these difficult times.
Video link, Barry Shearman.
Thank you, Madam Deputy Speaker. Can I ask the Secretary of State, he knows, he's very well aware that when he does good things, I tell him that so, and there's much to celebrate today. But before we get too euphoric, can I remind him that, was it 406 people died yesterday of COVID, 70 people have died in Huddersfield hospitals since January the 1st. The fight is still on, but the team working in my constituency and beyond is brilliant. But will he please, they're all keeping to the rules, will he stop the Prime Minister breaking all the rules, going around the country and stirring up discontent?
He was doing so well, Madam Deputy Speaker. I agree with all of what he was saying until the last bit. Of course the Prime Minister's going to go around the country and thank people for what they're doing. We've just heard from our colleague from Dewsbury about the very positive impact that the Prime Minister had on his visit to Dewsbury. I know that people across Scotland were very enthusiastic to see the Prime Minister visiting Scotland to say thank you to those working in the labs on the testing and on the vaccinations. Maybe the Prime Minister will come to Huddersfield, to the brilliant vaccination centre that they've got there, and if the Prime Minister can't make it, then maybe I should come to go with the Honourable Gentleman to say a great big thanks. Travelling around the country to thank people for their efforts is an important part of keeping the nation going in these difficult times.
Video link, Mark Pawsey.
Thank you, Madam Deputy Speaker, and more positive news, because among the 500,000 vaccinations provided across the country last Saturday were 750 at Lockhouse in Rugby, where over 11,000 have already been given, and priority group risks 1 to 4 will be completed ahead of schedule by this time next week. Will the Secretary of State thank the GPs and everyone involved in this achievement, and in particular the 100 or so volunteers at the site who've turned out for long shifts in all weathers, led by the Inspirational Centre Manager, Geeta Natarajan. And I wonder if you could just say a little more about the steps being taken to ensure that the second dose of the vaccine will be the same variety as the first.
State.
Deputy Speaker, I've always loved rugby, and the idea that rugby is going to deliver on that offer of categories 1 to 4, everybody in categories 1 to 4 having an offer of a jab a week early is music to my ears. I'm delighted to hear about it, and I can absolutely confirm that we have confidence in the supplies of vaccine to ensure that everybody can get a second jab of the same vaccination as they had first time round, unless there is a specific clinical reason not to, which would only happen in very, very rare circumstances. The plan is you get the same jab second time round as you got first.
Video link, Chris Stevens.
Thank you, Madam Deputy Speaker. According to the Global Institute's high-income countries, representing 16% of the world's population, currently have around 60% of the vaccines that have been purchased so far. So can the Secretary of State tell us what plans the government has to start sharing supplies with low and middle income countries, and if he can share with us the government's plans and an international approach?
Yes, this is a very important question, and whilst I'm incredibly proud of the UK vaccine rollout, and I'm very pleased that we bought early so that we have access to the supplies of 407 million doses, we are also deeply aware of our international obligations, both with the provision of the Oxford vaccine to the world, but also the financial support, essentially through COVAX, and also Gavi, to make sure that people across the world have access to this vaccine. It isn't either or, it's and. And while my first priority and my first responsibility as UK Health Secretary is to ensure that the UK has access to this vaccine, this is a disease that has demonstrated that it doesn't respect international boundaries, and it's important that everywhere gets access to the jab.
Video link, Catherine Fletcher.
Thank you, Madam Deputy Speaker. The variant of COVID that was first identified from South African samples has been found within a PR9 postcode. That postcode covers the town of Banks within South Ribble in Lancashire. Now, there's understandable concern with residents, and there's also a celebratable desire to do the right thing. So, can my honourable friend offer any reassurance to the residents so close to Southport, and set out what they can do with testing, for example, to do the right thing in this situation?
Yes, absolutely. The councils, it's Sefton Council that leads on this particular outbreak, but I understand that there are some residents in Lancashire that are in that postcode area. The website sets out where the door-to-door testing will cover, and the activities that the council are leading on, working with us, making sure that we get testing as broad as possible. But if you are in the PR9 postcode or any of the other postcodes that I set out yesterday, it is very important to be especially vigilant, and it is imperative to stay at home unless it is absolutely essential that you leave home. So I do understand the concern, of course I do, but the reason that we've been so clear that these are the postcode areas is because we do need people to take that action to limit the community spread in the vicinity around the cases that we've found.
Video link, Yvette Cooper.
Thank you, Madam Deputy Speaker. The Health Secretary rightly said our mission should be to stop the South Africa variant spreading. But the community spread shows border measures are failing to do that. He set out no timetable for quarantine hotels today. And 7 weeks after the variant was identified, it's still possible for people to travel home from South Africa and elsewhere with no quarantine hotels, no quarantine taxis, no test on arrival, and still go straight onto public transport in the UK. Why is that still allowed, and how long is he going to allow it for?
Well, as the Right Honourable Lady knows, we've brought in very significant measures at the border to control the arrival of those from countries at risk. For instance, South Africa and other Southern African nations, nations around Brazil and also Portugal. And the self-isolation requirements that she mentions are absolutely critical, but we also are, of course, looking at what further measures are necessary.
Video link, Martin Vickers.
Thank you, Madam Deputy Speaker. The rollout of vaccines in North and North East Lincolnshire is going extremely well, and I'm sure my right honourable friend will want to join me in congratulating all those involved for their magnificent efforts. Could I follow on from earlier questions about the housebound? Yesterday, I was contacted by the family of an elderly gentleman who lives alone, who'd received, in the rural part of my constituency, who'd received an invitation for a vaccination at a centre considerably far from his home, and he wanted it locally. I appreciate that there is a follow-up, but that initial letter can cause confusion for a number of people. Can my right honourable friend do all he can to assure me that the follow-up letter inviting them for a local vaccination comes swiftly after that first one?
Yes, I'm very happy to work with my honourable friend. And maybe the best thing is if I ask the Minister for Vaccine Rollout to call him straight away to ensure that his constituent gets the vaccination as locally as possible. But I also take on board his broader point, because it's not just about this constituent, important as that is, but it's about making sure everybody can have the vaccine as locally as reasonably possible. We also do, though, need a local voluntary effort, which is happening in so many parts of the country, to help elderly people to be able to get to a vaccination centre. And if a constituent is housebound, then of course the roving vaccination teams need to be able to reach them. That takes longer than vaccinating through any other route for obvious reasons, but it is a very important part of the scheme.
Video link, Leila Moran.
Thank you, Madam Deputy Speaker. I welcome the commitment from the Secretary of State to lean in, I think he said, to the international effort to roll out vaccines everywhere across the world. No one is safe until we are all safe, anywhere. Not least because if we don't do this in tandem, it increases the chances of variants coming here that would undermine our own impressive efforts. So when does the government plan to start parallel distribution of the vaccine, particularly to low-income countries, some of which have had no vaccines at all? And shouldn't it be as soon as we have completed the vaccination of our clinically most vulnerable?
Secretary of State.
Madam Deputy Speaker, after we've completed the vaccination of the clinically extremely vulnerable, there are still many millions of people here who are at risk of dying from this dreadful disease. So absolutely we will lean in to the international effort. Thanks to the fact that we didn't choose to join the EU scheme, we are of course far further ahead than we would have been otherwise, as she knows. And we will play that vital role internationally. But she'll also understand why it is so important that we fulfil our first duty to keep people in the UK safe.
Video link, Faye Jones.
Thank you, Madam Deputy Speaker. It's been a privilege to be one of the volunteers at my local vaccination centre in Bristol, and I commend Powys Teaching Health Board and all the vaccination staff for their efforts. But currently residents in Ustragynlais, the largest town in my constituency, have to travel over 50 miles to get their jabs. As a result of this, the local GP is working almost around the clock to ensure people who can't travel can get their vaccines. As well as thanking everyone involved in delivering the vaccine in Brecon and Ravensshire, would my right honourable friend confirm that the rollout is an agile system and that the government will not let the challenge of rural areas impede our progress?
Yes, across England we have set the goal of having a vaccination centre within 10 miles of where anybody lives. It is harder in the more rural parts, like her constituency, of course, and we are absolutely willing to support the Welsh NHS in delivery locally, and in fact the British Armed Services are involved in support of the rollout across Wales as they are in England. So I'm very happy to meet with her and discuss what further we can do to make sure that people can get the vaccination as easily and closely as possible in her sparse and very beautiful constituency.
Liz Twist, video link.
Thank you, Madam Deputy Speaker. A new research paper published today by Newcastle University demonstrates the link between poor mental health and welfare support. And this pandemic has particularly tested the mental health of so many of us. So will the Secretary of State urge the Chancellor of the Exchequer to keep the £20 universal credit top-up after March and to extend it to those on legacy benefits so that the mental health of those on benefits is not affected even more?
Secretary of State.
Thank you very much indeed. I'll take those representations to my Cabinet colleagues, Madam Deputy Speaker, as I know they're working hard to make sure that everybody gets the support that they need.
Video link, Sir David Evanet.
Thank you, Madam Deputy Speaker. The rollout of the vaccine across my borough of Bexley has been very successful today, and I congratulate all involved. Can my right honourable friend note that the NHS information and cooperation across our area of South East London has been absolutely superb? Will he confirm, though, that the second doses of the vaccine will be delivered on time, including to the housebound?
Secretary of State.
Yes, the second doses are incredibly important, and whilst the time from the first dose to the second dose is 12 weeks, it doesn't make it any less important that we have the vaccines ready, and we've got a high degree of confidence that they'll be there. And we are already planning for the rollout of the second doses because we know when each of the second doses becomes due because it's 12 weeks after the first dose. So that planning is in hand and frankly, compared to most of the planning that we've had time to do in this pandemic, 12 weeks is an absolute age.
Video link, Rachel Hopkins.
Thank you, Madam Deputy Speaker. The Joint Committee on Vaccine and Immunisation immunisation states that the implementation of the vaccine should also involve flexibility in vaccine deployment at a local level with due attention to, amongst other things, mitigating health inequalities. So will the Health Secretary outline whether his department believes that homeless people who have complex health conditions due to their accommodation status should be prioritised for vaccination?
Yes, I'm working with the Community Secretary on a specific programme for the rollout of the vaccine to people who are homeless.
Video link, Sir David Amos.
I very much associate myself with my right honourable friend's remarks about the noble Lord Fowler, who of course was in charge of the combined Department of Health and Social Security. And whilst I applaud the government's very wise decision not to sign up to the EU vaccination procurement programme, when I visit Highlands Vaccination Centre tomorrow, will I be able to reassure my constituents that they will still receive their second dose of the vaccine on time now that we have left the European Union?
Yes, and I'm very glad to say that we are working with our EU counterparts to ensure the fair distribution and manufacture of vaccines according to signed contracts, which is the right and proper way that it should be. Thankfully, we signed those contracts early and we made sure that we got solid contracts to deliver the necessary doses to the UK, and I look forward to those being delivered on, and I have assurances from all quarters that that is what is now going to happen.
Video link, Debbie Abrahams.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, we know there's a reduced antibody response against the new COVID variants for vaccinated blood. But can the Secretary of State say what is the level of change in this vaccine efficacy and what action is underway to update and approve new vaccines to address this? I'm particularly thinking of the E484K mutation found in both the Brazilian and South African variants.
Yes, she's absolutely right, Madam Deputy Speaker, to ask this critical question. The answer is we're doing a huge amount of work with the scientists and the pharmaceutical industry to develop modified vaccines should they be necessary. And we're also monitoring the results of work to understand the efficacy of the existing vaccines against the variants of concern. We do not have a point estimate for the difference in the efficacy of the vaccine. The efficacy needs to be measured both in terms of your likelihood of catching the disease and in terms of your likelihood of being hospitalized or dying from the disease. There is a significant amount of work underway to understand all of those things, both in labs and in the field. For instance, AstraZeneca has a trial in South Africa that it is revisiting to understand the progress of those who were vaccinated as part of the trial. And we will publish as much information as we get as soon as we credibly can. I wish I could put a number on the answer to the honourable lady's a very astute question, but unfortunately that is not scientifically credibly available yet.
The last question is a video link to Stephen Hammond.
Thank you, Madam Deputy Speaker, and can I congratulate my right honourable friend for his decisions of last year to guarantee the surplus supplies of vaccine, and can I also thank everybody in Wimbledon, the NHS and the volunteers who are delivering it. Clearly, getting the vaccine rollout as fast as possible is key, and therefore, can my right honourable friend confirm that he will be making sure that best practice advice is being given to every vaccine centre to ensure that there are no supplies not unused at the end of the day, and that there is a reserve list for appointments?
Yes, well, I'm very grateful to my honourable friend. The vaccine programme has been enormous hard work by a huge number of people, but it's very heartening to see it progress as it is, including in Wimbledon, where it is going well, and I'm very grateful for his support in making that happen. The need to use every last drop of this precious vaccine is paramount. The standard operating protocol clearly states that all vaccine doses that are available should be used. If you can get 11 doses out of the 10-dose AstraZeneca vial, then do so. It's now standard practice to get 6 out of the previously 5-dose Pfizer vial, and you should have a reserve list of people in categories 1 to 4 to be able to call up at the end of the day if there's any spare. But the most important thing is that if vaccine is going off, if it's coming to the end of its time that it's been out of the freezer for the Pfizer jab, then it should be used in all circumstances. We need to use every last drop, Madam Deputy Speaker.
I thank the Secretary of State for his statement, and we'll have a 3-minute suspension for cleaning. Order, order. Minister Nigel Adams to make a statement on the situation in Myanmar.
Thank you, Madam Deputy Speaker. I would like to update the House on the situation in Myanmar. On Sunday evening, Myanmar's armed forces, the Tatmadaw, seized control of the country, declaring a state of emergency in the early hours of Monday morning. The country is now under the effective control of the Commander-in-Chief and the Military Vice President, Mient Sway. At around 0200 hours local time on the 1st of February, the Tatmadaw began detaining politicians and civil society leaders across the country, including the democratically elected Aung San Suu Kyi and President U Min Thi. The Tatmadaw has said that this state of emergency will continue for a year. The army has also taken control of the airports. Only military broadcasters are still on air, and phone lines and the internet remain at risk of being disconnected again. The military's actions follow on from their accusations of fraud during November's election. Aung San Suu Kyi and the National League for Democracy won by a landslide, and the military-backed Union Solidarity and Development Party's share was drastically reduced. While there were significant concerns about the disenfranchisement of minority groups such as the Rohingya, there are no suggestions of widespread irregularities. International observers such as the Carter Center and the Asian Network for Free Elections found no evidence of significant irregularities in the elections. As such, the United Kingdom considers the election result to credibly reflect the will of the people, and that Aung San Suu Kyi's National League for Democracy Party are the rightful winners of the election. The Commander-in-Chief has indicated that they intend to hold new elections to replace the results of those in November 2020. Any dispute regarding the election results should be resolved through peaceful and lawful mechanisms. The Myanmar Supreme Court is hearing a case on alleged irregularities, but has not yet decided whether it has jurisdiction. The reports today of the arrest of the chair of the Union Election Commission are deeply concerning. Madam Deputy Speaker, the events of Sunday night have filled us all with a profound sense of revulsion and sadness. Our thoughts are with the people of Myanmar who have once again been robbed of their inherent democratic rights. The elections in 2020, though by no means perfect, were an important step on Myanmar's path to democracy. We and others welcome them as a strong endorsement of Myanmar's desire for a democratic future. Myanmar's transition has been troubled. A constitution rigged in favour of the military, a campaign of atrocities and systematic discrimination against the Rohingya and other minorities, and a faltering peace process. This coup threatens to set Myanmar's progress back by years, potentially decades. As such, we are clear in our condemnation of this coup, of the state of emergency opposed in Myanmar, and the unlawful detention of democratically elected politicians and civil society by the military. The Prime Minister and the Foreign Secretary both issued statements to this effect on Monday morning. It's essential that Aung San Suu Kyi and all those unlawfully detained are released. We must receive assurances that their safety, well-being and their rights are being respected. The state of emergency must be repealed, arbitrary detentions reversed, the outcome of the democratic elections respected, and the National Assembly peacefully reconvened. We are aware, Madam Deputy Speaker, that there is a risk that demonstrations could provoke a violent response, taking Myanmar back to the dark days of the 1988 uprising or the 2007 Saffron Revolution, in which scores of civilians were killed. As to the UK response, we are pursuing all levers to ensure a peaceful return to democracy. Firstly, we've made representations at the highest level within Myanmar to encourage all sides to resolve disputes in a peaceful and legal manner. The Foreign Secretary had a call scheduled for later this week with Aung San Suu Kyi prior to her detention. We are clear in our demands that this call goes ahead, and we hope it will serve as an opportunity to confirm her safety. I formally summoned Myanmar's ambassador to the UK to the Foreign Office yesterday. In the meeting, I condemned the military coup and arbitrary detention of civilians, including Aung San Suu Kyi, and made clear the democratic wishes of the people of Myanmar must be respected and the elected National Assembly peacefully reconvened. We're doing all we can, working with those in Myanmar, to support a peaceful resolution to this crisis. Secondly, the international community has a role to play. We are engaging with partners globally and in the region to help align objectives and find a resolution to the crisis. We will work through multilateral fora to ensure a strong and coordinated international response. As President, the Foreign Secretary is coordinating G7 partners on its response, aiming to build on its quick statement last week on Navalny. The UK has urgently convened the UN Security Council, who will meet later today. As a champion of the rules-based international order and democratic government, we're driving the international response, including in our role as President of both the G7 and the UN Security Council, urging the military to immediately hand back power to the government that was legitimately elected in November 2020. ASEAN also has an important role to play, as do the principles of the ASEAN Charter, including the rule of law, good governance, and the principles of democracy and constitutional government. We continue to engage with ASEAN partners to support a regional response, including a meeting I held with the Thai Vice Foreign Minister this morning. Thirdly, it is the military's actions that instigated this coup. The UK already has a number of measures in place in response to the military's past and ongoing atrocities. On the 19th of September 2017, the UK announced the suspension of all defence engagement and training with the Myanmar military by the MOD until there's a satisfactory resolution to the situation in Rakhine. The MOD no longer has a defence section in Yangon. The United Kingdom has already imposed sanctions on 16 individuals responsible for human rights violations in Myanmar. We sanctioned all 6 individuals named by the UN fact-finding mission report, including the Commander-in-Chief and his deputy. The Commander-in-Chief and his deputy are the architects of the current political situation. They also have the power to de-escalate the crisis and restore democracy. We will assess how best to engage with the military, if at all. We have also enhanced private sector due diligence to prevent UK funds going to military-owned companies. The UK does not provide direct financial aid to the Myanmar government, but we do provide some targeted support working through other international organisations and multilateral bodies. In light of the coup, the Foreign Secretary has today announced a review of all such indirect support involving the Myanmar government with a view to suspending it unless there are exceptional humanitarian reasons. It's important, Madam Deputy Speaker, that our response holds the military accountable. We will continue to support the people of Myanmar. We will continue leading the international response to this crisis and calling on the military leaders in Myanmar to relent, revoke the state of emergency, release members of the civilian government and civil society, including State Councillor Aung San Suu Kyi and President Win Myint, to reconvene the elected National Assembly, to respect the results of the November 2020 general election and accept the expressed wishes of the people of Myanmar. I commend this statement to the House.
I call Shadow Minister Stephen Kinnock, who has 5 minutes.
Thank you, Madam Deputy Speaker, and I'd like to thank the Minister for advance sight of his statement. Madam Deputy Speaker, the Labour Party will always speak up for universal rights and freedoms, for the rule of law and for democracy across the world, including in Myanmar. Yet we know that democracy is in retreat around the world, and for the first time since 2001, democratic governments are outnumbered by authoritarian regimes. What took place in Myanmar yesterday and over the weekend serves to remind us of the daunting scale and nature of the challenge that we're facing. This military coup is a flagrant breach of the constitution of Myanmar, and it must be condemned in the strongest terms. The army's claims of voter fraud are utterly spurious. This is a naked power grab. While Aung San Suu Kyi's failure to stand up for the human rights of the Rohingya people has been deeply troubling, the fact is that her party secured a landslide victory in the November elections, and Myanmar's young democracy must be respected and protected. And let us not forget the human cost of this coup. Many brave and elected representatives and activists were rounded up in the dead of night, their families terrified by the men in uniform on the doorstep. Now they languish in prison cells. How has it come to this? Well, for decades, the power-hungry Myanmar military has oppressed and persecuted the Burmese people, committing countless atrocities, most notably against the Rohingya, for which it currently stands accused of genocide in the International Court of Justice. And experts in Myanmar are clear that the tacit support of China, combined with the rest of the world turning a blind eye, has given the military the confidence to enact this coup, based on the assumption that the international backlash will be negligible and lethargic. Madam Deputy Speaker, the UK and the wider international community must act swiftly and effectively to prove the military wrong on this. The UK government must move from warm words of condemnation to tangible action. As the penholder on Myanmar at the Security Council, the UK has a particular and unique responsibility to lead the international response. We welcome the Security Council session the government has convened today, but we believe there are further steps that must be taken. First, the government must lead by example by imposing sanctions on the Myanmar military and all its business interests. When I recently urged the Minister to take this action last year, he argued against such measures on the grounds that it would have a negative impact on foreign investment into the Myanmar economy. Well, there's nothing like a military coup to damage foreign investment, Madam Deputy Speaker. So surely the Minister must now accept that his argument no longer stands up to scrutiny, and that this government must now immediately impose sanctions that directly target the military and their financial backers. We on these benches strongly support the Magnitsky sanctions against individuals in Myanmar, but let's be clear, they're designed predominantly for countries where senior officials have economic interests in the UK, such as in Russia and in China, and this is not the case for Myanmar. Second, the UK government should seek to extend the arms embargo against Myanmar so that it is as close as possible to global in its scale and scope. Clearly, authoritarian regimes such as Russia and China will be unlikely to participate, but we must seek to build the broadest possible coalition of countries committed to not selling weapons to Myanmar. Third, now must surely be the time for the Minister to commit the UK to joining with the Netherlands and Canada in formally supporting the Gambia in its case of genocide brought against Myanmar at the International Court of Justice. And will he also call for Myanmar's first report to the ICJ, published last June, to be made public in order to shine a light on the atrocities committed by the military? I'd also like to ask the Minister to set out what conversations he's had with the Bangladeshi government to ensure humanitarian aid contributed by the UK is sufficiently reaching the Rohingya who have fled to Cox's Bazar. And finally, what consular support is the UK government offering to UK citizens who are in Myanmar and caught in the middle of this appalling military coup? Madam Deputy Speaker, I respect the Minister, and I know that his heart is in the right place on this issue. But I have to say to him that this statement falls far short of what we need and what we expect. Nothing on sanctions, nothing on the ICJ. The people of Myanmar need a stronger response, and they need it now.
Thank you, Madam Deputy Speaker. And I thank the honourable gentleman for the tone of his response, and also for his welcoming of the international engagement, in particular at the UN Security Council. As he rightly remarks, as penholder, we have brought that forward by a day for a meeting on Myanmar at the Council as a matter of urgency, and that meeting will be taking place in New York this afternoon. He mentioned sanctions on the military. I would politely point out to the honourable gentleman, we've already imposed sanctions on 16 individuals responsible for human rights violations in Myanmar, including 6 individuals named by the UN fact-finding mission report. But of course, we will work closely with our international partners to consider next steps in that regard, and we will consider all the tools at our disposal. He also mentioned about the arms embargo and whether we would support international arms embargo. We're a long-standing supporter of an arms embargo in Myanmar. We've worked with EU partners to secure and tighten a strong EU arms embargo following the 2017 Rohingya crisis. Since we left the EU, Madam Deputy Speaker, we've transitioned this into domestic law. Our autonomous sanctions regulations prohibit the provision of military-related services, including the provision of technical assistance to or for the benefit of the Tatmadaw. He mentioned the case brought by the Gambia. We have been very clear in our support for the ICJ process, which is putting pressure on Myanmar, and particularly the military, to do more to protect the Rohingya. We've pressed the civilian government to engage constructively and transparently, and we do urge the military to comply with the provisional measures ruling. He also mentioned Bangladesh. We're working very closely with the Bangladesh authorities. We are speaking with Bangladesh government in terms of the support we are providing. We're the second largest donor to supporting the Rohingya who are currently in Bangladesh. We are following the advice very carefully of our post in Yangon to do with the situation involving UK nationals. We will continue to update British nationals in this regard. They're advised to stay at home, only make essential journeys, and continue to check travel advice and embassy social media pages. I've spoken with our ambassador a couple of occasions over the last 24 hours, and we're continuing to closely monitor the situation.
Chair of the Foreign Affairs Select Committee, Tom Tugendhat.
Thank you, Madam Deputy Speaker, and I welcome the statement from my honourable friend and indeed agree with much of what the opposition spokesman has said as well. When we're looking at sanctions here, we know that Myanmar Economic Holdings Limited is alleged to be paying out dividends of something around 18–20 billion US dollars a year to the army. Is it not particularly galling then to see that this army that claims to serve the people and claims to put the public interest first by overthrowing a democratically elected leader is the worst, the single worst country in the world for vaccinating its citizens? Does this not demonstrate that rather than being servants of the people, the Myanmar armed forces are its pillagers, its occupiers and its thieves?
Well, my honourable friend, the chair of the Select Committee, makes a very, very good point. The UK military, for example, on the contrary, has done a fantastic job supporting the rollout of the vaccinations here. My honourable friend knows that we unreservedly condemn the military coup in Myanmar and the detention of members of the government. The military's action is not conducive to supporting the most vulnerable people. So we do call for the peaceful reconvening of the National Assembly. The results of the elections in November 2020 must be adhered, and the expressed wishes of the people of Myanmar. They need a democratically elected government who can help them see through this pandemic.
I now call the SNP spokesperson, who is participating virtually and has 2 minutes. Alan Smith.
Thank you, Madam Deputy Speaker. I hope I've demonstrated in the House that I don't believe in fabricating difference, and I agree with all the content of the Minister's statement today, and I commend him upon it. as far as it goes, and I would like to press him a bit further on further action that I think would be useful to take forward. And I think this is yet another reminder of the importance, the real importance of all of us as a government, as a state, as individuals, being vocal advocates at home and abroad for the rule of law. And I would invite the Minister to mention to his ministerial colleagues just how damaging it was for the UK to be mulling the idea of breaking recently agreed international provisions in a limited and specific way. That really has weakened our credibility within this discussion, all of us. But I support very much the international efforts that he's taking forward, particularly within the G7. There is a position there that the UK can use to the betterment of this. And I think there's a strong case for further sanctions against the Burmese military. As an organisation, there's been welcome sanctions on individuals. I think there could be more of those. But on the military itself, it's a huge commercial enterprise and is vulnerable to sanction. I'd also like a reassurance for something he didn't mention, which was cooperation with the EU. And that I think the EU's position on this will be important, and coordinating with that will be very much to the benefit. And it's early days, of course, yet, but what assessment has been made by our mission within country on the already dreadful situation of the Rohingya? And is there a risk of flight of Rohingya into Cox's Bazar and into Bangladesh? And a reassurance that if more aid is necessary, we stand ready to provide it to the Bangladeshi government, because this will take a concerted international effort. And if it continues along those tracks, then he'll have our support. Thank you, Madam Speaker.
Again, can I thank the honourable gentleman for his tone, his cooperative tone on matters like this. It's really important that I believe we're all on the same page in this regard. And his comments about us working with international partners are absolutely right. Given our presidency of the G7 and the UN Security Council, we are using these opportunities to drive forward the international response. And this will include dealing and liaising with our friends in the EU. And we all need to stand together to demonstrate that we will not stand a subversion of democracy. We are talking with a broad range of international partners, including those the neighbours of Myanmar, especially the ASEAN countries. He mentioned aid this year in country, in Myanmar. The UK is spending 88 million people supporting the people of Myanmar. In addition, since 2017, we're spending almost £250 million supporting humanitarian aid, supporting the Rohingya who are displaced, who have found themselves in Bangladesh.
Video link, Imran Ahmed Khan.
Thank you, Madam Deputy Speaker. I'm sure, like all members of this House, I found myself deeply disappointed when Aung San Suu Kyi chose to take no action against the genocide of Rohingya. But that grave failure should not temper our condemnation of the quasi-constitutional military coup, which undermines the futures, freedoms and democratic rights of the Burmese people. Would my honourable friend the Minister further outline what his department is doing to promote fundamental and universal rights of democracy, freedom and liberty in Burma in light of the recent events?
I know, Madam Deputy Speaker, how passionate the honourable member, my friend, the member for Wakefield, feels about the issue of values and democracy. And I can assure him that the United Kingdom places the highest premium on respect for democracy and the rules-based international system. We've been talking to regional and international partners about this, and we call on Myanmar to respect the principles of the ASEAN Charter, including the rule of law, good governance, as I mentioned, and the principles of democracy and constitutional government.
Video link, Imran Hussain.
Madam Deputy Speaker, for over 3 years, I have repeatedly called for the government to enact sanctions against the Burmese military for their brutality in the Rohingya genocide. But on each occasion, these calls were rejected by the Foreign Office, who essentially told me that imposing sanctions would endanger the fledgling democracy in the country. Does the Minister now not agree that this military coup shows that these were unfounded claims and, frankly, poor excuses for refusing to act in the face of the genocide against the Rohingya, and that the government instead did more harm than good by emboldening the Burmese military.
Well, I'm not sure if the honourable member has kept up to speed, but in fact the United Kingdom has already imposed sanctions on military individuals, including the Commander-in-Chief and his deputy. We are absolutely clear, and if the honourable gentleman's campaigning over the last 3 years on this issue has led to that, then I congratulate him. But we've already delivered sanctions for human rights violations in Myanmar. Let's not be absolutely clear, Madam Deputy Speaker. The Commander-in-Chief and his deputy are the architects of this current crisis.
Jack Brereton.
Thank you, Madam Deputy Speaker. The actions of the Myanmar military are an assault on democracy and the democratically legitimate government. So would my right honourable friend agree with me that it is vital they immediately confirm the safety of Aung San Suu Kyi?
Oh, my honourable friend is absolutely right to raise the safety of Aung San Suu Kyi. I know our Prime Minister had a phone call with Aung San Suu Kyi before Christmas. It's essential, and the Foreign Secretary was due to have a phone call this week. It's essential that that she and all those that are arbitrarily detained are released. We must receive assurances that their safety, well-being and rights are respected. I reiterated this to the Myanmar ambassador when I summoned him to the Foreign Office yesterday. As I said, the call should have happened later this week. We hope it will be able to take place to serve as an assurance of her safety and well-being, because it's vital that we're able to confirm that she is safe.
Video link, Layla Moran.
Thank you, Madam Deputy Speaker. The Minister will know that the major player in this crisis is China. Myanmar is far more dependent on their economy than others, and the relationship between the military and the Chinese government has been ambiguous in the past, given how destabilising their actions are to the region. Now, notwithstanding whatever grievances we may have over the Uyghurs and Hong Kong, this is a moment where we should be working together, including with China, to solve this crisis. So can the Minister make an assessment of the likely response of China at this time? And has our government had conversations with the Chinese government about such a coordinated international response? Minister.
Well, very much the Foreign Secretary is leading on this issue with the G7. We hope to have some further news in this regard in the next day or so. But we are absolutely on the front foot internationally in this regard. The Honourable Lady, I know, is very passionate about this particular country. And let me be absolutely clear what we're calling for here, Madam Deputy Speaker. The military leaders must revoke this state of emergency and release the members of government and civil society.
Video link, Alex Shelbrook.
Thank you, Madam Deputy Speaker. The events in Myanmar have shown that democracy is fragile. And the reality is that the actions of the democracy-denying narcissistic Trump in the last 3 months has undermined those values. So therefore, could I ask my honourable friend, the Minister, to, as he said, not just work with the G7, but impress upon the new administration how important it is to show strength from established Western democracies, that it's important that democracy is honoured, and that as a group of G7 that we will be moving together to ensure that this comes to an end.
Minister.
I thank my honourable friend and neighbour for his question. Absolutely, through the G7 and through engaging the Human Rights Council, we are urgently convening, as I said, the UN Security Council. We have, of course, engaged with our American friends at both official level and at the Foreign Secretary level. Over the next day, we will be making sure that Myanmar is high up that agenda. We're using these opportunities to drive forward the international response. And as I said, we will not stand a subversion of democracy.
Video link, Kerry McCarthy.
Thank you, Madam Deputy Speaker. I've been privileged to visit Myanmar with the Westminster Foundation for Democracy, and again as an observer at the LCD's first party conference, which was a time of great optimism, sadly not entirely fulfilled. It's clear now that we could have handled things differently in that interim period, applying more pressure for constitutional reform and reducing the power of the military. So can the Minister just say a bit more about what we hope to achieve by sanctions now, other than the restoration of democracy and Aung San Suu Kyi being released from detention? What are our slightly longer term goals in terms of trying to reduce the power of the military and putting Myanmar on a more democratic footing?
Minister.
Thank the Honourable Lady for her questions. I think the reasons behind the sanctions, the Magnitsky-style sanctions announced a few months ago were pretty clear. We are absolutely clear that there were human rights violations in Myanmar, and we, I'll repeat, sanctioned all 6 of the individuals named by the UN fact-finding mission report. Obviously, we will work closely with our international partners to consider next steps in this regard. But our priority at this time is to ensure that the military leaders do revoke this state of emergency and, of course, release those, including Aung San Suu Kyi, and reconvene the elected National Assembly. Those are the UK government's priorities at this immediate time.
Anthony Mangnall.
Deputy Speaker, and I welcome the statement that the Minister has given. The events in Myanmar are a reminder that we need a strong international community to be able to respond to these sorts of events. And with that in mind, I echo the calls that other members have made about the need for further sanctions. But can I also draw his attention to the humanitarian violations that are going on, and that the need to create a Preventing Sexual Violence in Conflict body in this country with international cooperation to ensure that we can support survivors of sexual violence, of genocide, of human rights violations, to be able to document those cases and to be able to lead international criminal cases against those perpetrators.
I thank my honourable friend for his question. I know how passionate he feels about these issues, in particular with regard to his work prior to being elected in this House, working with the former Foreign Secretary. And I will absolutely repeat that it's completely unacceptable for a democratically elected government to be overthrown by the military in this way. Of course, we are working with international partners on all the issues he refers to. We will continue to do so. We're monitoring the situation, the humanitarian situation. We're very concerned about that during this, over the last 72 hours. As he will appreciate, getting information, getting to the places where we need to be is very difficult during just following a military coup. But he's right to raise the issues, and we will continue to monitor the situation extremely closely.
And Manjeet Singh Desi.
Thank you very much. Madam Deputy Speaker, this appalling military coup and overthrow of a democratically elected government is undoubtedly a major setback for the progress and development of Myanmar. However, the likes of me are particularly concerned about the desperate plight of the Rohingya Muslims who have faced a genocide, and with approximately 1 million having to flee their own country and now being refugees in Bangladesh and other nations. So what exactly is the Minister doing to spearhead an international effort to ensure that there is no further crackdown by the authoritarian military regime on the hundreds of thousands of Rohingyas still in Myanmar, many of whom are interned in camps, unable to move freely, with extremely limited access to basic health and education services?
Minister. I thank the honourable gentleman for his point, which is very well made. As he can appreciate, the situation's evolving rapidly in the country. We're monitoring the situation as closely as we can, but we're also working closely with our partners. I talked about us convening the meeting this afternoon in New York, so we can have a joint response with the UN Security Council. But also, I would just assure him that we will continue to provide the life-saving humanitarian assistance, including for the Rohingya, make sure that that continues. We're alert to the possibility of all sorts of horrific violence being committed, like identity-based violence, which there are reports of. We're one of the largest donors to the Rakhine state. It's one of the poorest states in Myanmar. Our assistance helps with education, nutrition, livelihoods and health, and we are supporting all communities.
Video link. Scott Benton.
Thank you, Mr. Deputy Speaker. May I thank my honourable friend for his statement. Is he able to update the House on what steps the government is taking to mobilise international diplomacy against the Myanmar military?
He's absolutely spot on to raise this. We are working through multilateral fora to ensure that there is a strong and coordinated international response. As I've said previously, we've urgently convened the UN Security Council for today. We're also leading the way through the G7 and engaging the Human Rights Council. So given our presidency of the G7 and the UNSC, we're using these as an opportunity to drive forward the international response. We must take leadership and demonstrate that we will not stand again for subversion of democracy.
Video link. Peter Grant.
Thank you, Mr. Deputy Speaker, and can I associate myself with the remarks of the Minister and the two opposition front bench spokespersons earlier. The Minister has reminded us that the Commander-in-Chief and his deputy are responsible for the current emergency situation in Myanmar. They and their associates are also responsible for a wholesale and systematic campaign of rape, torture and murder against Rohingya Muslims entirely for racist reasons. So can you give us an assurance that in amongst the other discussions that are now required within the international community, high up in that agenda will be a restated determination that everyone who was responsible for those atrocities in Myanmar will one day be brought to justice and held to account for their crimes?
The honourable gentleman again is right to raise this. We must ensure there is accountability for those who have committed atrocities. We're clear, the United Kingdom is clear that the Myanmar military undertook a campaign of ethnic cleansing against the Rohingya in 2017. We're pushing for those guilty of atrocities to be held to account. In our joint statement to the UN Security Council, Mr. Deputy Speaker, on the 11th September, we called for Myanmar to make progress on this accountability. And in the absence of a credible domestic process currently, all options must be on the table, including ICC referral.
Video link. Angela Richardson.
Thank you, Mr. Deputy Speaker. I'd like to thank my honourable friend for his statement today on the concerning situation in Myanmar. Does he agree with me that the UK must be at the forefront of condemning these actions at the United Nations?
My honourable friend is absolutely right. Yes, we are engaging with a range of partners to encourage dialogue, peaceful resolution of the crisis, and importantly, the restoration of democracy. The Foreign Secretary has been speaking to his counterparts from other states and has a call scheduled with the US Secretary of State for later this week. He will also be speaking to the Japanese Foreign and Defence Ministers this week. The Prime Minister is also trying to arrange a call with his Japanese counterpart. We will work through multilateral fora to ensure a strong and coordinated international response.
Video link. Jeremy Corbyn.
Thank you, Mr. Deputy Speaker. Obviously, we must all absolutely condemn the coup in Myanmar. It is appalling what has happened. But sadly, it's been a feature of the lives of people in Myanmar ever since the 1960s of an overpowering, brutal presence of the military. And even during the more recent, slightly more democratic period in Myanmar's history, the military have occupied a special place in which they've been essentially untrammeled by any democratic accountability whatsoever. And the Rohingya people have suffered and will continue to suffer as a result of that. Hopefully one day we'll look forward to a more democratic Myanmar. Would he agree with me that when that happy day eventually comes, there has to be a constitution which does not give unaccountable power to the military, but brings them under the control of a parliamentary democracy? I was very pleased that he mentioned the United Nations Human Rights Council in his statement and one of his responses. And would it be possible for him to urge the UN Human Rights Council to put together very rapidly a delegation to be sent both to Myanmar and to Cox's Bazar to examine the human rights abuses that have happened, take the necessary evidence and condemn those that should be condemned, sadly, including Aung San Suu Kyi, who stood up in support of the military when her country was quite rightly condemned for the treatment of the Rohingya people.
Thank the right honourable gentleman for his question. We, of course, will continue to work through all multilateral fora, including today's meeting of the UN Security Council, which we brought forward, and by pulling together our G7 partners as well and have the appropriate response. And I'm sure the right honourable gentleman would agree with me. What we want to see is the Myanmar military revoke this state of emergency. The civilian government, Aung San Suu Kyi, and civil society people who have been seized must be released. We want to see the reconvening, as I'm sure he does, of the National Assembly. And it's absolutely key that Myanmar respects the result of the November election and, more importantly, accept the expressed wish of the people of Myanmar.
Masrat Ghani.
Mr. Deputy Speaker, I welcome the Minister's statement, and in a previous job I was in Myanmar for the BBC, so it's so depressing to watch the new tragedy to unfold. The UN Security Council is holding an emergency meeting today, which is of course incredibly welcome. Does the Minister share my concern that China's stranglehold on UN institutions and its alleged closeness to the Myanmar military means that it might stifle the meeting today and going forward? And does the Minister offer any succour for people like me that hold those concerns?
Well, I thank my honourable friend for her remarks. Of course, we must work closely with our international partners. That's why we've brought forward today's meeting at the UN Security Council. Obviously, we can't second guess the outcome of the meeting this afternoon. I know and share many of the concerns that she has with the ability of countries to be able to veto action in that multilateral body, but be in no doubt the United Kingdom is on the front foot and leading the international response with regards to this crisis.
Video link. Chris Bryant.
Thank you, Mr. Deputy Speaker. The Burmese military is as corrupt, financially corrupt, as it is brutal and as it is anti-democratic. So can we not do more to make sure that Burmese military who have managed to squirrel away stolen assets from the Burmese people in the UK, in British overseas territories and in other democratic countries in the world cannot be returned to the Burmese people? And how can he be certain, whilst China still plays a role in refusing to allow those who are accused of genocide to come to a proper international court, how can he be sure that while China still holds that